what's brain fog and how does menopause affect it? I'm Zainab, I'm the pharmacist from PillSorted Pharmacy, and I'm going to cover why does it feel like our brain's not cooperating with us during menopause and how can we improve that and what to look out for. First of all, brain fog is very real. It has different symptoms for different people, but usually there's three that people talk about a lot. So the first one is forgetfulness. You forget your keys, your phone, your purse all the time. In the middle of a sentence, you might forget a word. It's in the tip of your tongue, but you can't say it. These are the forgetfulness signs. The other one is lack of concentration. It's very difficult to focus and learn something new, and you feel as soon as you learn it, it's gone. And the third one is losing your train of thought. These are the symptoms of brain fog. A lot of different things can bring it up. Even one of the symptoms of COVID was brain fog. I'm going to focus on menopause related brain fog because that's when usually most of us women experience it for the first time. So why does brain fog happen during menopause? It's quite multifactorial, and I'll touch base on three aspects that can bring the brain fog during menopause. The first one is the hormone fluctuations. We've covered this before, that during menopause there's a huge dip in our female hormones, estrogen, progesterone and testosterone, and these hormones have a huge effect on our mood and on our focus levels. So that is overarching reason that menopause brings up the brain fog. The other one is symptom related. So a lot of women during menopause experience lighter sleep and disturbed sleep because of the night sweats, and sleep has a huge effect on our concentration and brings up the brain fog as well. And the third reason is the workload of this stage of our lives. A lot of us at this stage, we are both caring for our elderly parents, we might be responsible for our younger children, and we are pushing our careers. This brings a lot of work and can cause stress. Stress by itself can cause fluctuation in our hormones, affect our sleep, affect our concentration and brain fog. How can we treat it? For lifestyle wise, there's 4 factors. The 2 most important ones are sleep and stress support. So for the sleep, it's really important to create that routine to protect that sleep. If you feel some days that your concentration is being much more affected, you really are struggling to focus, check if you've slept enough. If you haven't, make sure that you put it in your plans to have a proper quality sleep. For the stress support, again, it's super important, especially around bedtime. So try things like a couple of minutes of deep breathing, proactively focusing on the good things that have happened in that day, because they tremendously affect your calm. And the calmer you are, the easier that you can sleep and the better quality of sleep. And the third one, hydration and nutrition. These 2 are very important. If you're dehydrated or you don't have your blood glucose levels have dipped, it will cause confusion and dizziness. That will make the brain fog much worse. And the last one, movement. So any sort of activity that you enjoy, just a couple of minutes even in the day, be it dancing, be it running, be it walking, anything. It extremely helps that mental clarity, even if it's just pacing up and down the room for a couple of minutes. Medicine wise, what are the things that we look in? HRTs, hormone replacement therapy, is really important to help overcome a lot of the menopause symptoms. Talking about the HRT with your healthcare professional, finding the right one can improve your concentration, can take away the brain fog, and it can help you a lot during this time. Now I want to focus on weight loss and on GLP, because sometimes that becomes even harder to manage when you have brain fog and you want to create new routines, you want to plan nutrition. If you're taking the GLPs, thinking about what day of the week you've taken it, which site you've injected it, these become more of a mental workload for you. So it's really important to focus and see what can we do. For the GLP injections, there is a lot of interesting feedback from patients that they find better focus and better mental clarity once they are on the GLP and they've lost weight. One of the known side effects effects is actually lighter sleep, especially 2 to 3 days after the injection. It might cause a much lighter sleep on that night, and you might wake up and not be able to fall back asleep. So these are the known effects that it might have on your sleep. However, it's not known to make it worse. Now, weight loss itself, a couple of important things. We've touched base about low glucose, low sugar, and dehydration that can cause the confusion become more. The other important thing is if you try to go to bed hungry, so you've not had enough of a calorie intake, that will make your sleep become very light, so you'll keep on waking up. I know it's one of the ways to stave off hunger to fall asleep, but you don't want to be too hungry. What are the things that you need to look out for and ask for medical advice sooner? If you experience sudden confusion, or you feel that your face is going a little bit numb, or your speech is becoming a bit slurry, those are the times that you need immediate urgent medical help. So if you experiencing feeling your heartbeat, or you're breathing too fast, these might be signs of panic symptoms. So again, it's better to get some advice. If you wake up and you're really tired, or your family tell you that you've been snoring, those are the times to be checked for sleep apnea. As a recap, menopause brain fog is common. The best levers we have to improve it are sleep and stress support, in addition to good hydration, nutrition, and movement. Weight management can support you with better clarity. If you need help managing this stage of your life, feel free to reach out to us. We're here for that clinician-led safe advice. Thank you.